name is Dr. Sally Johnson, and I'm one of the children's kidney specialists at the National Renal Complement Therapeutic Centre in Newcastle. I'm really pleased to be able to talk to you today about a subject we've had a lot of questions about, and that's the impact of COVID-19 on atypical aHUS patients. What I'm going to cover in my talk is a brief recap about atypical aHUS, complement and eculizumab, just to add to the film that you've just watched. And then I'm going to go on to a series of questions that we have been asked in our service about COVID-19. So those questions are, am I at risk of severe COVID-19 disease? Is it safe for me to go to school or work? Will COVID-19 trigger an episode of atypical aHUS? Should I stay on eculizumab treatment during the pandemic? Did I hear that they're treating COVID-19 with eculizumab? Should I have the COVID-19 vaccine when it is available? And what should I do if I think I'm unwell with COVID-19? So here's a quick bite-sized recap. On the left, we've got a picture of the kidney at the bottom. And when we expand one little area of that and then expand again, we see one of the little filtering units of the kidney called the glomerulus. And the glomerulus is a ball of blood vessels. And it's really important because this is the area that's affected by atypical aHUS. If we take a kidney biopsy from a normal kidney, the glomerulus shows as a ball of blood vessels with nice open circles where the blood can flow through. If we take a kidney biopsy from somebody with atypical aHUS, that ball of blood vessels has become very solid and swollen and filled in, and there's not much room for the blood to flow through. And it's this that causes the changes that we see in atypical aHUS. If you think about one of those blood vessels we've just been looking at and cut it down its length, you see that we have red blood cells and platelets whizzing along in the blood. And as they flow through, they keep their normal shape. This is where I introduce complement, which is a family of proteins that form part of the immune system, and the job of complement is to kill bugs. And normally your body protects itself from damage by complement. But when this goes wrong, complement can damage the body's own tissues. So if we take that blood vessel and we see complement being activated on the blood vessel surface, this leads to the swollen blood vessels that we saw in the last slide, and this leads to the blood cells being damaged and the anemia and low platelet count and low blood flow to the kidney that is typical of aHUS. And we know that eculizumab is a treatment that blocks the complement system and stops this from happening and therefore treats atypical aHUS. So on to our first question. Am I at risk of severe COVID-19 disease? So we all know from watching the news and hearing reports that the risk of severe disease is higher in those with underlying health conditions. And this is quite concerning for somebody who has a health condition. It's true to say that there is no simple answer that covers all atypical aHUS patients. And that's because the risk of COVID-19 disease is more reliant on your underlying kidney function than it is on your actual disease or whether you're on treatment with eculizumab. So if we take somebody with atypical aHUS, they might be on eculizumab treatment or they might be not on eculizumab treatment, perhaps because they've withdrawn from treatment as part of a trial, or perhaps because they've had an episode that wasn't treated and got better on its own, but they know they're at risk of another episode. So in each of these groups of patients, you could have a patient who has normal kidney function, someone who has a degree of chronic kidney disease or kidney impairment, or somebody that's had a kidney transplant. And we know that whether you're on eculizumab or not on eculizumab, if you have normal kidney function, then your risk of severe COVID-19 does not seem to be elevated. So same as the background population as far as we understand. If you have a degree of chronic kidney disease or have had a kidney transplant in the past, then whether you're on treatment with eculizumab or not, your risk of severe COVID-19 is higher, and I shall discuss this more in the next slide. So this is a table which is taken from the Renal Association website, and this is a guide for your kidney doctor to help understand what your risk of severe COVID-19 disease is. And this takes into account things such as your underlying kidney disease, whether you've had a transplant, and what your level of kidney function is, as well as your age. And your risk is higher with increasing age and with certain diagnoses. But the important news for atypical aHUS patients is that neither atypical aHUS nor eculizumab treatment occur in this, put you at higher risk in this grid. It's much more your age and your underlying kidney function. So a question we've been asked a lot is it safe to go to school? And I think the short answer to that is yes. For patients with atypical aHUS, on or off eculizumab treatment, it is safe to go to school. And we know this because, again, through the Renal Association website, we have information from the British Association of Paediatric Nephrology, who've been monitoring children with kidney disease and the risk of severe COVID over the pandemic. So we know that children, whatever their underlying condition or health, are at much less risk of severe disease than adults. And following the information that has come out of the pandemic, the BAPN that looks after young children with kidney disease has identified a very small group of children who need to be considered as extremely vulnerable, and that's those with kidney transplants in the last 3 months, or those on very high levels of immune suppressive treatment, such as high-dose steroids with another agent. It does not include eculizumab in this group. So essentially, from a child's point of view, the risk of severe COVID-19 is very small, and we think it is safe for your child to go to school. The next question is it safe to go to work? So, as you probably are aware, the concept of shielding vulnerable patients ended on the 1st of August, and we're now in a phase without shielding where we have tried to help patients understand their risk in order to modify their practice, whether they go to work, whether they work from home, etc. The same website, the Renal Association, has got a lot of information to help your doctor to help understand your risk and work with you. So this website includes letters that doctors can use to send to patients and their family members to help employers to understand their risk. And this is a decision which needs to be made between you and your nephrologist. But the bottom line is if you have normal kidney function, then whether you're on eculizumab or not, having atypical aHUS would not place you in a high risk group, and therefore you would be safe to go to work. It's those other factors, such as your age and your kidney function, which are more important. The next question is, will COVID-19 trigger an episode of atypical aHUS? Well, we know that viral infections are a trigger for an episode of aHUS in people who are susceptible. But we need to think about different categories of patients at the moment when considering this question. So, people who are on eculizumab treatment for their atypical aHUS are very, very unlikely to have a relapse of aHUS caused by any virus, COVID-19 or any virus. And that's because their complement system is blocked. So we don't think that this group of people are at risk of an episode of atypical aHUS with COVID-19 infection. There are patients who have had a previous episode of aHUS, but they're not on eculizumab now, or perhaps they were on it and they're no longer on it. And I suppose the answer to this question for that group of patients is possibly. It is possible that COVID-19 could trigger an episode of aHUS. That's because the immune system becomes activated and complement is activated. However, we haven't seen any patients since March in whom this has happened. And the final group of patients for this question are those who know that they're at risk of atypical aHUS because they carry a genetic change that's present in their family, but they themselves have never had an episode of atypical aHUS. And I think the answer for this group is the same as the previous group. It's possible that COVID-19 could trigger an episode of atypical aHUS. However, since March, we haven't seen any yet. The next question is, should I stay on eculizumab treatment? And the answer to this is really that the pandemic is not generally a reason to stop eculizumab treatment in anybody. Some people might be stopping during this period. It might be that they're a part of the eculizumab withdrawal trial that Professor Sheeran is going to tell us about shortly. Or it might be that for other reasons, a decision is made between you, your doctor, and the team at the NRCTC that it is right to stop eculizumab, but this would not be due to the pandemic. The next question is, did you hear correctly that they were treating COVID-19 with eculizumab? And the short answer is, yes, you did hear. So it's important here to think about what's happening in COVID-19 infection. As you know, patients who have difficulty have really severe lung disease. And we think that that lung injury is due to the effects of the virus itself and to an overreacting immune system. And you will remember that we talked about complement being a part of the immune system. Previous coronavirus infections, such as SARS, have been studied, and it has been found that complement and complement activation can contribute to the lung injury in severe coronavirus infections. And this has also been shown in mice who have a model of that disease, and they've been given drugs like eculizumab, mouse eculizumab, which blocks the injury of the lungs in those mice. So there's some evidence that complement being overactive might actually cause some of the lung injury in COVID-19 infection. Patients with severe COVID-19 disease have a number of features in common with atypical aHUS. They might have low platelets, they might have blood clots in the small blood vessels, and they've also been shown to have evidence of activation of the complement system in their bloodstream. And it's not surprising, therefore, that some investigators have given their patients eculizumab to see if it might rescue their severe lung disease. And there have been some positive results, but as you know, it's not possible to make any conclusions from small individual cases because there's a lot of bias in the reporting of those. And therefore, large trials are now underway of eculizumab and its longer-acting cousin ravulizumab, that Professor Cavan is going to tell us about shortly, are underway in severe COVID-19 disease. The next question is, should I have the COVID-19 vaccine when it's available? We're all looking forward to this being available. You may have heard that some patients in the past have had an episode of atypical aHUS that's been triggered after receiving a vaccination. And that's because vaccination activates the immune system and can activate complement. If a patient is controlled on eculizumab treatment, then that should not happen, and therefore vaccines should not trigger an episode of aHUS if you're on eculizumab. It is a theoretical risk for patients at risk of aHUS but who are not on eculizumab, such as we've spoken about earlier. However, vaccination is extremely important to protect against deadly diseases, and every decision is a balance between the effect you want and the side effects that you might get. And we recommend at the NRCTC that all patients with atypical aHUS, whether on eculizumab or not, should have all the vaccinations that are indicated for them. And this includes the flu vaccine if they are in an at-risk group for flu, who normally get sent the flu jab invitation. So therefore, when a COVID-19 vaccine is available, we will almost certainly be recommending that atypical HUS patients receive it, but we will be monitoring very closely how patients are getting on, and we would be aware if there are any concerns about that. And the final question is, what should I do if I think I'm unwell with COVID-19? So we all know by now the symptoms that would indicate this, and we know that we have to book a test and that we have to follow advice from NHS 111. However, you know that you have atypical HUS or that you're at risk, and you mustn't forget that. So if you are on eculizumab treatment, then you will know that you are at risk of meningococcal disease. Fever can be a sign of meningococcal disease. And if you develop a fever and you are concerned that you are unwell, then the most important thing for you is to go to A&E to be assessed for meningococcal disease and not to be sent off to a test centre trying to find a test for COVID. So it's important that you might need a COVID test, but if that's thought necessary by the team looking after you in the hospital, then they would do that. So don't delay the presentation of possible meningococcal disease because you think you have to have a COVID test. And remember that any viral infections, whether COVID-19 or not, could carry the risk of an episode of atypical HUS if you're not on eculizumab. And therefore, we always say that if you are not recovering from a viral infection in the way that you think you should, then it's important to get checked out. And even if you have COVID-19, we are all still here to see patients with atypical HUS and with other chronic diseases. And hospitals and GP practices have COVID secure pathways. And if you are concerned that you are unwell, please don't be concerned about seeking help. Please either go to A&E, call your GP, call us at the NRCTC, and we would be able to advise. But don't forget about atypical HUS when thinking about COVID-19. So, in summary, we've covered quite a lot, and the important takeaway points are that somebody's risk of COVID-19 severe disease depends more upon their age and their kidney function than it does their diagnosis of atypical HUS or their treatment with eculizumab. We think that, like any virus, COVID-19 could possibly trigger an episode of atypical HUS, although we haven't seen that happen yet. In general, we are recommending that eculizumab treatment should not be stopped because of the pandemic. We've heard that it's possible that patients with COVID-19 disease might benefit from eculizumab treatment. And we have discussed that it's important to follow your usual advice if you are unwell, in addition to any specific COVID-19 advice that you've received.